All right. So this is an impact slide for the topic I'm going to discuss today. And I just copied it from Illinois Department of Health. And it shows one of the presenting features of a person who is suffering from one of the clinical condition we call ascites. Ascites. And ascites means fluid in abdomen. And what I want you to pay attention to this particular case is, of course, a male, and you can see engorged veins. So it's like a pressure there. What do you think would be the commonest cause in US of a person having ascites? What would be the commonest cause? This kind of a picture. Male? Fibroid. No, fibroid is not a common cause. Contaminated water, no. Alcohol. There you go. Alcohol. That's actually, this is the commonest cause of this kind of picture. Chronic use of alcohol. So alcohol remains one of the other common causes other than hepatitis that we normally see. Alcoholic liver and alcohol. In medicine, there is a called Dangerous Drug Act. So they list very dangerous drugs, marijuana and all, because they can be used medically, but they are considered as the dangerous drug. And what so happened was we were taught that there's a bunch of people like big shots sitting somewhere in the world, Geneva, wanted to come up a universal proposal for let the people know these are the dangerous drugs. And guess what? They did not include alcohol there. And there was a joke over there. That's because alcohol was served during the meeting. So what's the point? So alcohol is a drug. It's one of the commonest drugs that may cause liver failure, chronic liver failure. And you may see a picture like this, okay? In this particular case, you can see that, as I said, I got from Department of Health, Illinois, and hepatitis B. So that's unfortunate picture. And I'm pretty sure it's mandatory for all of us to be vaccinated in hospital setting. You would not be allowed to come into the school if you were not vaccinated for hepatitis B. So hepatitis B is a viral infection. So let's talk about the rest of the viruses. Again, like any other viruses, they come in different forms and shapes. And what I'm going to do is that I'm going to cover 4 or 5 major type of viruses today. And I would not spend much of the time because I just figured out for the last 8 years, I usually used to finish virology in 10 lectures, but I've already added 5 more lectures. So you see some of the lectures will overlap. So there are 5 additional things I've already gone to that. And I figured out maybe the reason is kind of, I go in detail, quiz you and things of that nature. But hepatitis is important. And I would want you to go and look at clinical picture of each and everything. So you can see from here, your challenge will be to differentiate hepatitis A from B, B from B and D and C. So these are some of the challenges that you have. There are a lot of ways to learn it. I'm going to give you some mnemonics. One of the easiest thing that I want you to do is that look at the case summaries, because that may have an impact on your mind and you may remember that. So you can see hepatitis A, 37-year-old man, and he goes through a dinner. So it's more of something to do with eating, something to do with fecal oral, as compared to hepatitis B, where you have a typical intravenous drug user. And again, hepatitis B and D, you may have IV drug user, and leading to massive hepatic necrosis and then dies. So this is very serious. And hepatitis C per se, again, is a little bit undetected, and many times you pick it up by ELISA, and you may have a lag time. So we can pick up hepatitis C now and develop liver failure, cirrhosis, and you may end up needing a liver transplant. So hepatitis C has picked up recently. Okay, so these are the clinical summaries of some of the patients that you can go through. As far as I'm concerned, as a part of this course that you need to be tested for, hepatitis A virus is single-stranded RNA and a family member of picorna virus. And as you can see from here, as we speak, some of the viruses will be RNA, some of the virus will be DNA. This particular has already RNA there, small virus for RNA. If you look at the structure for hepatitis A virus, 27 nanometer, it has a single-stranded RNA with so many bases. It has a capsid, right? And then again, you will see there is a viral protein. You can see from here, viral protein, a genomic viral proteins that's specific for this particular virus. That's something that you need to remember, that it has a positive sense RNA, single-stranded. It has a, and if you remember basic genetics for RNA, there's going to be 3 end and the 5 end. So this is 3 end, this is 5 end, more towards the 5 end of the genome. Now, the typical spread, as I told you, the case is an acquisition of an hepatitis A virus. It's going to get absorbed from the intestine, goes to the blood, and of course, as the word suggests, tropism and liking for liver. So it will go into the liver and secreted into bile. Bile goes into intestine and it comes to stools. It's like fecal-oral transmission. It can be acquired by contaminated water as well. The time course of infection, again, you can see that there is a ingestion of virus, and then again, the incubation period where the virus is dividing. And you can see the typical clinical picture comes late. So clinical pictures come a little bit late. And if you want to detect that, you may want to go for liver biopsy. You can do liver biopsy, and it's excreted in feces. It's all go in the blood, but it only remains in the blood for a very short time. This means if you go for the beginning or the end, you may not be able to find. If I was to look at an antibody for hepatitis B, for all of you, it's going to be positive because you all been vaccinated for that. Okay. So you can see from here, hepatitis A specific IgG, and as the quality of IgG is, it stays for a long time. So there is a vaccine available for hepatitis A. And as far as feces is concerned, you're going to get it very early. One of the important things that we normally see presentation of hepatitis virus is jaundice. It may not be the only cause of jaundice. So jaundice and ecteric symptoms. So it's like itchy thing. And one of the classical features that you get for hepatitis is that you have nausea, very bad nausea. And you want to throw up. You don't want to feel eating. So these are some very specific things that are happening with this virus, especially for hepatitis A virus. Now, if you go at looking at the epidemiology, I'm going to discuss that. But by the end of the day, anything that's fecal oral is pretty much the same. The water is tested for hepatitis A virus. You have to be very careful if you go and visit those areas, Africa, Asia, where the water is unfit for human consumption. So you have to make sure either you get vaccinated for that before you go over there. And then again, also make sure that you go for a clean water. So I want you to pay attention. Let me enlarge that because I can't even. So you can see from here, people who can get it. So you can get it from fecal oral for contamination. And one of very specific, especially in California, people who are fond of shellfish may get that. So that's one indication. You want to maybe very careful. Uncooked salad, maybe it's like a delicacy for some cultures. But those people who are there for food handlers, they are at risk. Then again, people who are in a setup where there is pretty much unsanitary condition, children and so on and so forth may get. And remember that some of the high-risk group, like pregnant women, if they get it, they is associated with high mortality. So along with hepatitis A plus hepatitis E. So we'll talk about hepatitis E later. It's found everywhere, as you can see. Control, again, as I said, that in this part of the world we give killed vaccine, but if you were to go to China or you come from China, they're going to go for a live vaccine. And of course, the argument is live vaccine is always better, but there's always a risk factor involved with the live thing. And with all these litigations that we have, we are more kind of careful because the people who make vaccine, they're not going to make any profit if somebody's going to sue them if even one person gets hepatitis. So that's kind of thing that we normally keep in mind. The other important thing for this virus, as you can see from the picture, is that you can be infected without knowing it, or you're shedding off. We say asymptomatic shedding. That's also important for these viruses. Now, if you were to ask, for example, one of the questions that came last year, so you just need to pick up an incorrect statement of hepatitis A virus. And again, incorrect is it has mono serotype. It cannot have many serotype because I just told you the vaccine is available. So that's kind of a common sense thing that if a vaccine is available, the chances are that there is only one serotype, and we have successfully had vaccine for that. Another question for hepatitis A. So you can see very generic and questions which are related to the concept of viruses and antiviral therapy as a whole. I just told you that confer short-term protection. So this is an incorrect. It really gives a long-term protection because I just showed you the IgG that stays on the peak for good. I mean, for all practical reasons. Okay. So A was RNA virus, and B, C, and D happen to be DNA virus. So we get HepaDNA virus, HepaRNA virus, that was picoviruses. So we'll lump them together in a group because they have some commonalities. Again, some of the unique features for these viruses. Again, you can see that virus has double-stranded circular DNA genome as compared to the single-stranded RNA genome with VPG that I told you. As far as replication is concerned, it is through the circular RNA intermediate. Virus carries a reverse transcriptase. And which other virus I told you carries the reverse transcriptase? AIDS virus carries the reverse transcriptase. Now, some of the virus, especially this virus, it encodes for those specific proteins. I mean, there are tons of protein, but if we mention some particular protein, what we are trying to do is that we're going to make that either as a diagnostic test, or we're going to make it as an antibody titer or titer, right? For example, if I was to ask you, one of the patients has high level of VPG, right? And I ask you, what do you think, which virus are we looking for? So A, because VPG is specific for A. Now, in this case, if you look at hepatitis B virus, these proteins are considered as antigens, like we discussed earlier. So hepatitis B virus, I'm going to talk about later as well, has some of the antigens which are expressed on the surface. We call surface antigen. So the small s over here stands for the surface antigen, and they are L, M, and S. Whereas hepatitis B may have an antigen in the envelope. So E small was the envelope, or hepatitis B virus can have a virus which we call it core virus. So it's like inside. So sometimes within the capsid, inside the capsid, outside the capsid. Depends upon how the body is going to look at it. Okay, and then again, as we said, HBV has a strict tissue tropism to the liver. I mean, it goes without understanding the concept, hepatitis tropism for liver, but sometime it may be our lack of understanding, and tomorrow we may come up with some other tropism for that. But most of the time, if a cell gets infected with hepatitis B virus, it makes a lot of surface antigens. So a lot of surface antigens are there. And the other important thing is that hepatitis B virus can integrate into host chromosome. So if I tell you hepatitis B virus or any virus has an ability to integrate in host chromosome, so what do you think will be the danger? What I'm trying to imply here. Say it louder, yeah. It can cause? Which disease? Cancer. Simple, cancer. Any virus, the ability of viruses to cause cancer is because of their ability to be incorporated into gene. So hepatitis B can cause cancer. That's what it means. That's the same statement, but said in a different way. It can integrate into host chromosome. Okay, then again, we have high-risk groups. All of us are high-risk groups in medical profession because we come across people's needle stick and so on and so forth, very common. And then again, there are certain people endemic. What does endemic mean? Hepatitis B is always present there. It's not endemic in this part of the world, but it's endemic in China, parts of Africa, Alaska. Well, Alaska, I want to take my words back. If you do consider, Alaska is there, and then Pacific Islands. The other important thing is that those babies who are born vertical transmission, born to mother infected with hepatitis B virus, that's another important thing that you have to be careful. All IV drug users, all IV drugs is simple. They all are infected with hepatitis, no matter how sterile they're gonna use. Okay, so that's taken for granted. The moment, if I ask you a case, there is one intravascular, drug user, you start thinking of hepatitis B. I mean, it can also cause A. They may have multiple problems, but hepatitis B for sure. Also, hepatitis B happens to be an STD as well. Right? Hepatitis B, CDC considers as a risk group for people who have multiple sex partners, either in homosexual or even heterosexual relationships may get it. So that's another important thing that you have to keep in mind. People who have hemophiliacs because they need continuous supply of the blood, and the people who donate the blood, for example, the blood bank who tests for hepatitis B virus, we want you to give your blood if you're infected with that, okay? All of us come in contact with the blood, healthcare person, we are all high-risk group, okay? And then again, what do you think, residents and staff members of institution for mentally retarded, what makes you think that they are a high-risk group? We're talking about the mentally retarded. These are basically, I will ask you the staff members of that infrastructure. And guess? Louder. Yeah. Yes, very good. They get bitten. Exactly right. Because they're mentally retarded, those people, oh, they are in big time trouble. They'll bite them. They can even bite physicians. So that's the reason. You're absolutely right. Very good. Okay, and then again, people who are hemodialysis patient and all these kind of organ transplantation, if you cut and open, any injury will open the door for these infections. I just told you one of the questions that came last year. So some of the important thing is that you need to find out that it's sexually transmitted both ways. Oral drug users, of course, if I write oral drugs, we have to be careful because why would an oral drug user get sometimes, distractions are such that you have to really understand what's going on. They are intravenous, not oral. Perinatally, acquired at the time of the birth because there's a birth trauma. No matter whatever happens, there's a trauma at birth, both the mother and both to the baby. Horizontally, via saliva, skin, and particular daycare centers. Again, that horizontal especially means for mothers suckling their babies, would also mean in STD, where there is a mixing and matching of saliva of partners. That will also is risk for you getting hepatitis. Okay, now I just talked about hepatitis B virus. The other name for hepatitis B virus is called DNA particle. And I want you to look at the now the structural element, and that's very important. And you can also see that hepatitis B virus has a little bit of pleomorphism. It can come into that small particle, or it can be a little bit longitudinal with a little bit higher surface area. Now, I want you to pay attention to the antigens over here, because that's, if you don't understand the antigen, you will never understand the immune response to it. Now you can see from here, this is a structure 42 nanometer as compared to 27 I told you about the hepatitis A. So twice the size. And then again, if you go over here, you will see that has a DNA virus, so the DNA over here. And then some of the protein kinases. So protein kinases, does anyone remember what's the significance of protein kinases? Yeah, signaling pathway. Protein kinase is very important signaling pathways that are required for the signaling either way, outside in, inside out. And I also told you that when we talk of HIV, we're going to talk about the blockers for that. Now you can see from here, this is a core antigen. There's a core antigen over here in the core of the virus. And then again, it's either C or E. So we C and E as a part of envelope but that envelope doesn't mean the other envelope that we were talking about earlier. DNA, again, double-stranded. It also comes from DNA polymerase. I just told you, why would a virus bring a polymerase? Because you want to come and have its own enzyme system. So any virus that has polymerase is going to be more pathogenic as compared to the one who's not. Then again, we talked about hepatitis surface antigen. So you can see 3 surface antigen, L, M, and S. And the other important thing, I think is going to come later. Let me go to that. There's a term I'm going to talk about today, and it's called GP. So you can see from here, GP, base pair. So can anybody make a guess what the GP would be? Not a general practitioner other than that. GP 42, GP 36, any guess? Louder. Glycoprotein, very good, glycoprotein. GP stands for glycoprotein, very important aspect for you to understand that these glycoproteins are there for attachment. And we're gonna go after them to stop viruses getting into them. Because if you understand this GP concept, you will understand HIV virus. Because some of the drugs are very specific for GP. In this case, you can see there is 3 important glycoproteins, 42, 36, and 27. And as we move along, there will be some comparison for you to make sure that you know the number of these glycoproteins because the drugs are acting on that. Okay, very good. All right. Now again, replication of hepatitis virus, I don't have to go to it over and over again. You pretty much know that right from the beginning, there is an entry into the hepatocyte, and then it's going to be uncoating, you can see, and then going into the nucleus, which is a DNA virus, and then macromolecular synthesis, and then all these things are assembled and secreted out endocytosis or budding out, probably that's the better word for us. And also keep in mind when we talk of these important aspects, so you can see from here that virus has attachment for the liver, and then all these things will cause death of the liver cell. That's why we have structural problems. You either have a liver disease for sure, acute liver damage, or chronic liver damage. So acute liver damage or chronic liver damage. So these both are important. And then again, if you see the question from the last year. I mean, I cannot come up with any simple question than that, because how can be a hepatitis not a hepatropic virus? I mean, the answer is already there, because the name comes from its tropism. So it is a hepatropic. So that's incorrect. How could it not be a hepatropic? The rest of the things are important in terms of your understanding. Okay, same question over here. Which one of the following is our virulence factors of HBV? So this either is going to go for overproduction of surface antigen, or is going to go for overproduction of the surface antigen as a replication and act as a decoy, meaning your system would not be able to produce antibodies against this. And then again, it can bind to neutralizing antibodies. So these could be the added virulence factor of this particular. The answer is all of them are correct. All of them are the virulence factor of hepatitis B. It produces surface antigen. It produces especially surface antigen as a decoy, so that your immune system doesn't know what's going on. And it also binds to neutralizing antibodies, so it's going to make it ineffective, and that may cause problems. Okay, now spread of hepatitis B virus. This is one of the most important, I would say, figure in your book, that not only explains to you pathogenesis, but also explains to you how are we going to go and block it. Now, again, these are the high-risk groups. You can get it from blood, infected blood, IV drug user, neonatal, sexual transmission, we talked about that. So all of these people will have a virus running in the blood. Okay. Once it goes into the blood, of course, it has a tropism for liver. It's going to go for liver, right? And you, like us who've been vaccinated with hepatitis B, if we do get entry of this particular virus, we have an antibody to stop it. So that's where it could be stopped. So the action of this antibody that we've been given is basically at this level before it goes and attaches to the liver. As compared to the person who does not have this vaccination, will have a very severe liver disease. And once it goes in the liver, I just told you, it starts producing surface antigen. So this means if a person is infected with hepatitis B and is going to come to the clinic, I'm going to test for antigen. I'm going to go and test for the surface antigen. If it's positive, you've been infected with that. But we can also at that level give you an antibody to block that, because the virus wants to produce surface antigen and we want to block it. The second antibody is going to work over here. And then if you don't do that, so the chances are this antigen antibody complex will get deposited into different places, and you may have immune complex disease, as we may have, I mean, not may have, we did actually discuss that in immune complex diseases in immunology. Now, what may happen that once you have hepatitis B viral infection of the liver, your cell-mediated immune response is going to come because you've not been vaccinated for that. You don't have an antibody for that. So that's a fight that system puts up over here. You never know. I mean, I would say it's not going to work, but you never know. But the chances are higher percentage of people are going to get it. That's like statistical thing. So we still teach it can be resolved, and you may be symptomatic. So from liver, you will have viremia. So you have that virus running in your blood. So once you have that virus running into the blood, then you are going to excrete it. So you can see from here, you're going to excrete it, mother's milk, vaginal secretions, blood, semen, and saliva. So you can see that is the reason for it to be an STD. That is the reason for it to be vertical transmission. And that could be the reason that if one of the case study I ask you, the mother is infected with hepatitis B virus, they didn't go for vaginal delivery, they took the C-section, but she wants to kind of feed the baby milk. So what is your opinion on that? So you can see you're not going to allow mother to do that. And the reason is because her milk is teeming with virus. Okay? So these are the body secretions that are teeming with person who may have had hepatitis B virus. Okay? And that's how the transmission. So when we say transmission, so if I ask you like which of the following will transmit hepatitis B virus, I'm going to list all of these and maybe one distractor. Understand? So this is something that you need to pretty much know and advise people and be advised yourself as what is going on in terms of the pathogenesis. So this is pathogenesis. Okay, the worldwide prevalence hepatitis B, and I think I'm going to use another term I may have used. You may be a carrier. You may be a carrier, right? Because like once you get infected with hepatitis B virus, you're gonna have it for the rest of your life. Okay, because viruses are gonna stay. Right? They will hide. They will go. We talked about hepatitis. We talk about HPV. We talk about HSV. That is the problem of mostly the STDs as well. Now, yesterday and even this morning also, I wanted to upload the latest figures, but unfortunately, they have not really kind of updated that. We still have pretty much the same incidence. You can see incidence of, say, hepatitis B surface antigen. So the virus breaks apart. It pushes too much of surface antigen. So that's a diagnostic test. So you're going to call 100 people and test them for surface antigen. That's what we normally do. And you can see over here, very high Africa. You can see the black dot over here, very high incidence of liver cancer. I just told you. So all those people who have hepatitis B virus also have a very high hepatitis cancer as well. That's the link of hepatitis B being integrated into human genome. So you can see from here, all these countries. Is it Canada? I think, yeah. Okay, Alaska and Canada. And then for some reason, the virus is very high, and they also have high incidence for that. Okay. And this is called, the cancer is called primary hepatocellular carcinoma, because virus goes over there, messes up the whole system, takes over the genome, and then creates all this mutation for the cells. We have a low incidence generally, but we have higher incidence in the high-risk groups. I just told you, the high-risk groups that we already discussed. Now, the other term that I'm going to use is that acute infection or chronic infection. Acute infection versus chronic infection, because the chances are acute infection is going to go to chronic infection, and then chronic hepatitis will eventually be responsible for cancer, because cancer is not an acute phenomenon. It takes a while. Okay, so you can see from these scenarios that we have, for example, on the top over here. So you can see from here, let's say a person has hepatitis B virus, okay? And then there's gonna be cell-mediated response, and then body tries to fight. He has jaundice, enzyme, and the body removes 30% of the virus and 60% hides there, still stays over there, you see that? And that one will lead to chronic disease with milder symptoms, okay? And that virus that stays over there for longer period of time, we want to call is delta agents. We call it like a delta agent. Now, once you have chronically infected with hepatitis B virus, so what may happen is that this particular delta agent can come and recur and cause fulminant hepatitis. That's like acute hepatitis again. Remember when we talked of inflammation, I told you acute, chronic, acute on chronic. Okay. So that always can come. So in this case, if a cancer is going to come from here, chronic infection, we have primary hepatocellular carcinoma. Or the other picture will be that you may have chronic liver disease, cirrhosis. So cirrhosis is another liver disease, and I just gave you an example for that. That other than hepatitis B virus, alcohol is the commonest cause that we have over here. Okay. Now, if you look at, again, the whole symptoms of acute viral hepatitis picture, and it's also very commonly asked question is that there are 4 phases for that. So you can see from here, you get exposed, inoculation phase, incubation period when the virus kind of going to go divide, pre-ecteric, ecteric also is like an itchy thing, ecteric, and convalescent period. And that over here is called acute disease. And you can see the presentation, firstly is fever, rash, arthritis, and you may have jaundice, dark urine, malaise. I just gave you an example of malaise, anorexia, very important, nausea, right upper quadrant pain, 60%, and that's a typical condition. And when it waves off and you go for the convalescent period, and then it can either go in acute, but you can see the clinical picture of hepatitis B is like a acute liver disease. This scenario is typically for acute liver disease. Now, if you look the clinical outcome, if you look at the clinical picture for that, these are some of the statistics you have to keep in mind. You have an acute hepatitis B. What may happen that 90% may get resolved, and 9% you have. So what they do is that once you get infected with hepatitis B virus, they will monitor your surface antigen, whether it's going up and down. That's what they normally do. So what happened is if your surface antigen remains positive for the 6 months, then you're going to go into this chronic situation. Or some of them, like 1%, are going to go fulminant hepatitis, they're not going to recover. And this is a scenario of unvaccinated person. Okay. Now, let's talk about this 9% who have surface antigen present more than 6 months. Even for that group, 50% may resolve. And the other 3 can either be asymptomatic, or they go for chronic persistent hepatitis, or they may have chronic active hepatitis. These are 2 very important clinical pictures that you need to know. Once they teach you hepatitis, they're going to talk about that. And the acute hepatitis, chronic hepatitis, difference, then chronic persistent and chronic active. The question that normally comes is, which of these 2, chronic persistent or chronic active, is going to cause cancer? That's one of the questions that normally come. And you can see from here, this is the chronic active. Okay. So chronic active usually is more malignant as compared to chronic persistent, because chronic active can still show whatever other symptoms are, right? And remember when I say tropism, so you would have thought that hepatitis B virus is going to go for liver. Good, that's true. But nobody is going to stop this virus for going into the joints, for example, or going into the kidneys. It also may show that picture. It could be directly from the virus. It could be the surface antigen causing problem. But chronic active hepatitis is the one that causes hepatitis cell. So they would do liver biopsies over time for the people and want to find out. And I don't want you to know much about the pathophysiology other than what I just showed you, that it causes the chronic active causes cancer. Okay, now this is another important serological test, and hepatitis B virus is one of those viruses that you're going to be bombarded with the questions for serology. And the reason being because some of the concepts are very important, especially for healthcare people. Why should you be vaccinated? What are the tests available? So let's start, for example, from the top over here, that you can see that these are months after exposure. So we're talking about like 2 years. So it's a long time. And these are the serological events that is happening is that you got surface antigen, it's going to be positive at about 2 months later. And then virus shedding takes place over here. So this is a virus shedding, right? So we are talking about two important things in this graph over here. One is an antigen, the other is an antibody. And I just told you, if you were to pick up a patient within 2 months of infection, you should not be testing for antibodies because antibodies are not there yet. You should be testing for the surface antigen. So you can see, as I just told you, surface antigen is the most important test. Okay? And then again, the other antibodies will come later. So you have an antibody against the core antigen, and you can also have an antibody that may come later. Okay? But mostly, let me enlarge that. So you can see from here, surface antigen, when the virus has been shed, but there's no antibodies over here. They're all antigens over here. And when we move along later part of the clinical picture, then where you pick up these antibodies. So you have an antibody against the surface antigen, you have an antibody against the core antigen, but you have an antibody against the E antigens, right? And what does liver enzyme mean? Why do you want to do liver enzyme? Liver function, very good. Because we want to find out how good is your liver. Otherwise, we're going to send you for liver transplant. If the function element is gone, liver enzymes are messed up, then we have a problem here. And also you can see from here again that from months to years, in this picture over here, the month to year, you always have elevated a presence of surface antigen. You see that? You will never get rid of surface antigen. If you look at the antigens for E, again, it's going to stay for a couple of months or maybe at the most 5-6 years. But as far as virus shedding is concerned, in the second half of the graph, virus shedding is continuous for a person infected with hepatitis B virus. That's the reason we want to vaccinate all healthcare people, because you're going to come across these people who may have had this virus and they're going to shed it on you. Okay, so you can see from here, it is a continuous line for virus shedding. Okay, so we still will monitor liver enzyme, but when you tell me you have had this infection 10 years ago, so I'm going to look for anti-HBE, not other antibody. Okay, so that's where anytime after 5 years of the initial contact, you're going to go for that. So what they do is that they run a profile for that. And if you see in the profile this anti-HBE is positive, so you can kind of think, well, he may have had or she may have had infection 5 years ago. Okay, so this is the serology in terms of the tests that we normally do and tests that we normally recommend. Last year question, I'm going to run through that. You can read it on your own. I just explained that to you. For hepatitis C virus, again, it's an acute infection. These statistics may vary. We just still want to use that most of the time. So the chances are 15% of the people recover, 15% can have a cirrhosis. We are more worried for persistent infection. And why are we worried for persistent infection? Why are we worried about persistent infection? No, see there? Cancer. So hepatitis B can cause cancer. Hepatitis C can also cancer. But most of these cancers are chronic hepatitis. So they are chronic hepatitis. So if you, once they teach you, alcohol intoxication and other things, we're going to discuss that in detail. But just keep in mind, it's not an acute, but a chronic. And hepatitis C virus can also cause hepatitis carcinoma, though in a smaller percentage, but I also told you in some of the countries is very high. Again, this is a good slide for lumping the B, C, and D viruses together. And I will just make you focus on this group. Well, let's go for the transmission, because transmission is always a case for in terms of hepatitis B or C or A. Now, this virus is also there in blood, semen, vaginal secretions, saliva, and mother's milk. So pretty much the same situation that we talk about hepatitis B. People get it via needle stick injury, shared drug, and then it is also sexual intercourse. But keep in mind that in the previous one, don't assume that it's only for people visiting STD clinic and people visiting, high-risk people and so multiple sex partners. This is also considered as a normal monogamous or heterosexual relationship. You may acquire that, but the risk is high. In terms of these people, children, very high. And then we have adults, people. There's another problem with hepatitis. The problem is that, like STD, so you get a STD from your partner, a B virus. It's not that that will be the only virus you get. You usually will get B and C. So you can imagine if the percentage is 20% for B, 30% for C, so you have very high chances of getting a cancer in terms of we call co-infection or superinfection, right? So you can either get superinfection with the D or C. So you can see if you get superinfection with C, it puts you at a very high risk for cirrhosis and cancer. Okay, so whatever percentages we talked about is going to go proportionally high if you are co-infected. So that also is a problem in terms of co-infection, especially for these viruses. They are present all over the world. There is no seasonal incidence that we normally see. All right. Last year's question. Again, I will let you read on your own. And lastly, D virus. Again, you can see we used to consider it as a B virus, honestly, because the reason was that this also had hepatitis B surface antigen as a code, right? But many a time what happened is a little bit of changes that we figured out over time, especially for the delta antigen over here, right? So we wanted to put it in the previous one, but if there's a major difference, then you had to separate that, okay? Now, these are the consequences of the delta virus infection. Delta virus is signed for the delta. If you have a hepatitis B virus plus delta, then you again will have all three pictures that we were talking about. If you have a super infection. So you can see what they're trying to tell you over here is when they talk of co-infection, they talk of acute infection. So if you pay attention over here, pretty much the same. The difference is that here we have hepatitis B virus plus Delta. Over here we have chronic hepatitis B virus plus Delta. So this is the kind of technical difference in terms of what. But the other important thing that you can see over here, severe progression than shorter arrow. So that's another important thing is say, so you have a longer arrow in terms of having all the three pictures as compared to a shorter arrow which shows incubation. Okay, so that's very graphically represented what you call a consequence of this book. So the chances are high. Does that make sense? Okay. So the other, I mean, it's like spin of the word. So the other thing is that if I was to ask you, can Delta virus itself cause all these kind of outcomes? The answer is no, because it has to combine with hepatitis B virus. So it requires the presence of HPV. That's what it says over here. Delta virus requires the presence of HPV virus unless you have these two scenarios. That was the reason initially we used to think that it's a part of that, but now we want to separate that. Okay, and last one, I mean, it's good. You can spend time on your own. It pretty much summarizes the features of all these consequences in terms of how you acquire hepatitis A, B, C, D, and E. I remember I used to myself teach students, we used to call that non-A, non-B, and still most of the senior physicians will still call that, but what they mean is a C. At that time, we weren't sure. And these are the viruses over here. So you can see of all these viruses, hepatitis B has a DNA, and rest of them are RNA. So these are RNA viruses. Transmission for this one is a fecal oral. So A and E are fecal oral as compared to B, C, and D, which are parenteral. You can see from here are sexual. These are the size at incubation period. And you can see from here very high incubation period for hepatitis C. Severity of the disease varies. Mortality, again, hepatitis C has the highest mortality as compared to any other viruses. And then again, if you look at the chronicity, that what are the chances of, if I was to ask you, which of the following viruses have either a carrier state or ability for chronicity, the answer is, again, you can see B, C, and D, whereas A and E do not have chronicity, and these are the one they are fecal oral as compared to anything else. Okay, and then again, you can see from here what type of laboratory diagnosis that we normally do, and what are the clinical diseases associated with that. And the most important clinical diseases associated with these two over here, you can see cirrhosis and cancer. So you can see from here, B and C are associated with cancer. Okay, so I'll stop here, and good day today because we were able to cover everything within one lecture, no overlap. One thing